insurance. We continue our efforts to make sure that every youngster in this state has access to quality health care. We set out on that journey last year. This is a continuation of our trip. And I think it also will focus more attention on roughly 250,000 Iowa adults that don't have health insurance, and basically try to work over the next year or two to develop a plan that would provide an affordable product to those 250,000 Iowans, more than 80% of whom work every day but simply can't afford their health care. So I think our work in making, probably being the first state in the country to be able to credibly say that we're providing health care to every youngster is certainly a worthy goal. The overall conversation about our health care system from the other side reminds me of a Twilight Zone episode. The other side seems to argue for the status quo. We'll pick around the edges on some cost containment. We don't see any proposals from the other side on cost containment. But our system, our healthcare system is very sick. It may be even in fatal condition. We spend per capita twice as much as any other industrialized country in the world. Each of us spends twice as much as the people in France, Great Britain, Canada for a system. We're spending the Treasury. We're spending our hard-earned dollars. Healthcare costs remain out of control. And if you look at these other countries where they spend less than we do, they also cover everybody. So we're spending twice as much as anybody, and we've got like 50 million Americans with nothing. 250,000 of them live here in Iowa. Businesses and individuals and even governments, local governments, school boards, state government, businesses everywhere struggle with trying to provide health insurance for their employees. A huge burden to taxpayers, but a huge burden to employers. Medical debt, leading cause of bankruptcy in the country. Senator Gronstel talked about Medicare and Medicaid. Those are probably the two most popular public programs in the country. They are basically socialized medicine for seniors, the S word, socialized medicine for seniors, and socialized medicine for poor people, because we think we ought to take care of poor people and kids. And then we look at the quality. We're spending twice as much as anybody else. And when you look at one measure, life expectancy, we're 30th in the world. If you look at the nations that belong to the UN, we're 45th in the world, life expectancy. So we're paying through the nose. The quality is pretty rough, and everybody wants to try and maintain the status quo of the system that's kind of messed up. And when we talk about choice and competition, boy, we've honed that down. We've got the best choice and competition you could have. We've been working on it for a very long time. And yet we're spending money we don't have. And the challenge coming up that I've heard from members, and it's a real challenge, we can figure out the next private insurance product, but what's it going to take? $1 trillion in the country, almost $1 billion in Iowa to try and buy that. We need a new model. This is our attempt, I think, at trying to move the ball ahead. I hope that at the federal level, we can find some reform with the new administration. Americans are ready for it. Small businesses are ready for it. I'm ready for it. You're ready for it. Sometimes I don't think you really have much idea on how to get there. But Senator Hatch, I think this is a positive move. I wish it were more, but it keeps the ball rolling ahead and keeps our focus on this important issue. Thank you, Mr. President.